Hello everyone. So in this video, we are going to discuss about some behavioral disorders. Most importantly, pica, thumb sucking, and breath holding spells. So first one is the pica. Pica definition, which means the pica is defined as ingestion of the non-nutritive substances at an age when this behavior is developmentally inappropriate. Usually, the pica, which is considered as a normal mouthing behavior up to the age of 2 years of age, and beyond that, this is a developmentally inappropriate behavior. So that is known as the pica. Pica is defined as an ingestion of the non-nutritive substances at an age when this behavior is developmentally inappropriate. And when this pica happens at the within 2 years of age, it is not pica. And beyond that, it is inappropriate for the development. It is known as the pica. So etiology is there are different etiology for the pica behavior. That is, first one is the underlying mental retardation and developmental disabilities, and the second one is parental neglect, and the third one is iron deficiency. That is the most common cause for the pica, and the fourth one is zinc deficiency. And the common the substances, that is non-nutritive substances which are usually ingested are the plaster, charcoal, paint, and earth. And the pagophagy is called the eating of ice, and the geophagy is called the eating earth. And because of this pica behavior, that is ingestion of the non-nutritive substances inappropriate for the development, there are some effects on the child. That is, first effect is the worm infestations, then we have mineral and vitamin deficiencies, then lead poisoning because of the paint and earth eating ingestion, then we have choking, intestinal obstruction, of the perforation. These are the effects of the pica on the child. And what are the management options? That is, it is some of the pica behavior, because it is because of the deficiencies like iron and zinc, so we have to supplement iron and zinc. And because of this effect of pica on the child as worm infestation, we have to give deworming, and we have to give psychotherapy and behavioral modification for the as the definitive therapy for the pica. So this is all about the pica. Then another is the thumb sucking. Another behavioral disorder is the thumb sucking. That is definition, which means thumb sucking is defined as placement of the thumb into the mouth, as the name indicates. And it is usually thumb sucking is normal in the infancy, and beyond that, that is abnormal in the preschool and above years of age. So thumb sucking is usually normal in the infancy, but it's abnormal in the preschool and above years of age. And the etiology of the thumb sucking is that it is usually psychological, that is, which may start after birth of sibling or when it's stress. And also it may be happens because of habitual reasons. Then effects, because of the thumb sucking, the effects are, it can lead to dentofacial structure abnormalities and malocclusion because of the continuous thumb sucking. And the management of these thumb sucking is, the definitive therapy is the psychotherapy, motivational therapy, and then occupy the child in actively engaging their hands. Instead of place the thumb into the mouth, occupy the child and actively engage in their hands. So the child doesn't place the thumb into the mouth. And anxiety management skills, and also orthodontic appliances, which may also be used for the management of the thumb sucking. So these are all about the thumb sucking. Then about the breath holding spells, that is the one of the most important behavioral disorder. It is characterized by the development of the cyanosis or pallor following the apnea after a bout of crying. That is, after the child is crying, there will be a apnea, and that is followed by the cyanosis or pallor. That is called the breath holding spells. Then it is of two types: cyanotic breath holding spells are there, and pallid breath holding spells are there. Episodes which usually start between the age group of the 6 to 18 months of age. And what are all the etiology of the breath holding spells? First one is genetic association. If there is any genetic association, there will be the presence of breath holding spells is there. And disciplinary conflict between the parent and infant, which also results in the breath holding spells. And if there is an iron deficiency, anemia, or autonomic dysfunction, that also results in the breath holding spells. So these are the four etiological factors for the breath holding spells. Then going to the clinical features of the breath holding spells, we already told that there are two varieties of the breath holding spells, that is cyanotic, and the second one is pallid. In the cyanotic type, The clinical feature is that in the order of first the child crying, then that is followed by the hyperventilation that results in the apnea, cyanosis, and loss of consciousness, tonic posturing or the twitching, and the child becomes limp. Then in the pallid type, the clinical features, the child develops pallor instead of the cyanosis. In the cyanotic type, there will be cyanosis followed by the apnea. Then in the pallid type, there will be pallor instead of the cyanosis. And this is the table be showing the difference between the pallid breath holding spell and the cyanotic breath holding spell. The pallid breath holding spell, which usually occurs after crying, and the cyanotic breath holding are also after crying occurs. And the respiratory rate, the pallid breath holding spells, there will be apnea, and in the case of cyanotic breath holding spells, there will be tachypnea. That is increased rate of the respiratory rate. Then time. The palate breath holding spells, which is few seconds, it is lasts for the few seconds or minutes, and the cyanotic halting breath spells, which will be occurs for a longer time compared to the palate breath holding spells. And the onset is spells within seconds happens in the case of the palate breath holding spells, but in the cyanotic breath holding spells, the spells only after crying for some time. The differential diagnosis for the breath holding spells are epilepsy, the cyanotic spells in the cyanotic congenital heart disease, and these are the differential diagnosis for the breath holding spells. Then going to the treatment modalities of the breath holding spells. First one is treatment with oral iron. Even if there is no anemia, we have to supplement oral iron because there is a strong evidence of the response to iron therapy. Then we have to go for psychotherapy, and paracetam can also be used. And the prognosis, it has an excellent prognosis for the breath holding spells. Most of the children which are symptoms free by the 5 to 6 years of age. Okay. Then we have the enuresis, that is definition, which means enuresis, which is defined as the voiding of the urine into the cloths or bed occurring at least twice a week or 3 consecutive months. Okay, so beyond the age of the 5 years of age, that is, within the age of 5 years, it is enuresis is usually normal, but beyond the age of 5 years, it is abnormal. That is enuresis, which is defined as voiding of the urine into the cloths or bed occurring at least twice a week for 3 consecutive. That is, 3 consecutive month ആയിട്ട് occurring at least twice a week. ആ 3 consecutive month twice a week ആയിട്ട് if there is a voiding of urine into the cloths or bed, that is called as the enuresis, and it is beyond the age of 5 years. That is the most important. And within the age of 5 years, it is normal, completely normal. And the nocturnal enuresis, that is voiding during the sleep, is called the nocturnal enuresis. And diurnal enuresis, which means voiding during the daytime, that is called the diurnal enuresis. And there are classification for the enuresis, that is primary and secondary. The primary is contribute to 75% of the cases, and the child has never been wet at night. That is called that is a primary. And due to the poor toilet training. Secondary, the child has been dry for at least 6 months and bedwetting starts again. And precipitated by the stressful events like arrival of a sibling and shifting to a new house. That is the secondary enuresis. And the etiology of the enuresis is that the first one is psychological factors, that is like marital conflict, birth of a sibling, etc., and poor toilet training of a child, and threadworm infestation, chronic constipation, voiding dysfunction, and anatomic causes, and genitourinary infections. These are the etiology for the enuresis. And then how will you diagnose the case of a enuresis? We have to take a detailed history and physical examination. Then we have to carry out the investigations to rule out other causes only if clinically suspected. We have to go for urine analysis and culture, X-rays of lumbosacral spine, ultrasonogram, then MCU and urodynamic studies, we have to go for it. So by that, we have to diagnose the condition and to diagnose the etiology of the disease. Then we have to go for treatment. The first is the behavioral modification. There are two modalities, by the behavioral modification and by the drugs we can treat the enuresis. Behavioral modification, which include restricting the fluid at the bedtime, waking the child to void during the night, bladder strengthening exercises, alarm system, reward the child for the dry night. That is, give something for the child to do not pass the urine. That is, reward the child for dry night and ask to wash their soiled clothes once bedwetting occurs. Avoid humiliation or punishment by the parents. Stress and anxiety management. These are the behavioral modification as a treatment modality. Then we have to use drugs like imipramine hydrochloride 1 to 1.5 milligram per kilogram per day at bedtime for 3 to 6 months continuously. And we have to give desmopressin nasal spray, but now it is not used now. Then we have to give oxybutynine 10 to 20 milligram per day for the 3 to 6 months. So these are all about the enuresis. So definition, it is usually normal within the age of 5 years, and beyond the age of years it is abnormal, and it is occurring at least twice a week. അതായത് ഒരു വീക്കിൽ 2 പ്രാവശ്യം for consecutive 3 months. That is called the enuresis. And there are classifications like primary and secondary. Primary child has never been wet at night. അത് ഒരിക്കലും അതിനു മുമ്പ് ന്യൂറോസിസ് നടന്നിട്ടില്ല. പക്ഷെങ്കിൽ it is the first time that the child is wet at night. That is because of the poor toilet training. And the secondary child has been dry for at least 6 months and bedwetting starts again. Usually there is a prior episode of the enuresis there, and after 6 months of dry episode, there will be start again of the bedwetting. That is called the enuresis. That is because of the stressful events like arrival of a sibling and shifting to a new house. This is the classification. Etiology is also psychosocial factors, and the other factors are also the diagnosis modality and the treatment. And that is both behavioral modification drugs. So these are all about the behavioral disorders. Thank you.